Hello and welcome to COVID Conversations here on WNCU 90.7 FM. And we are streaming on YouTube, on Facebook, and on Instagram. I'm your host, Kimberley Cartwright. I'm the News and Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about how COVID-19 is definitely affecting our world. And today we're going to talk about blood donations through the American Red Cross. The organization continues to experience severe blood shortage that is negatively affecting blood products available across the country. And my guest today is Barry Porter. He is the Triangle Area Chapter Director for the American Red Cross. And we'll talk about how you can help today. Hi, Barry. How you doing?
Hello, Kimberly. Good to be with you again.
Yes, it's very nice to see you again. And I want to start by asking you, who can give blood? So when we talk about it, I'd like to know who are the candidates who are possibly available, who can.
Sure. Well, the first couple of rules are some simple numbers that we have to pay attention to, and that's your age. You have to be at least 17 years of age in most states, but in some states like North Carolina, with parental consent, you can actually start giving blood at 16. So at least 17, at least, so here's the next number, at least 110 pounds, and in general, good health. And you might qualify then to be a blood donor. But we know that 38% of Americans fit into that greater than 16 and weighing at least 110 pounds. And so 38% of the American population can give blood, Kimberly, but only about 5% do. And so it's constantly pretty much the same people giving. We get a few new donors every day, maybe about out of 100 donors, 4 or 5 are first time or new donors. So we're constantly trying to message to people that it's a safe activity, it's a needed activity, and it's not too difficult to do to help save a life.
So tell me, what's your biggest concern about blood products today?
Sure. So each and every 2 seconds in America, somebody gets a blood transfusion. That might be from red cells, platelets, or plasma, components of our blood that all have a particular function. Red cells carry oxygen and carbon dioxide away from our cells to keep the energy and the fuel flowing in the cells in the body. Plasma is that liquid gold coloring that actually becomes a transport of amino acids and proteins and is very, very critical for burn patients, as an example. And then platelets are the clotting factor. The moment you get a small nick or cut on your finger and it starts to clot, the platelets are a part of what's sticking to that wound and are very important. Platelets, as an example, about 20% of all platelet products go to cancer patients. So you can see that one blood donation might impact up to 3 lives. And so it's the challenge to keep an adequate, safe blood supply in the right type with the right product, so that when the hospital calls and says, here's our order for the day, or when they have an emergency in place, a stat order, that we're able to fulfill that. And right now we're struggling very much to do that.
How much blood do you need to meet the demand? So when we're talking about shortage, what's the number?
Yeah, exactly. So when you look at it across America, just in the American Red Cross, and we collect about 42% of all the blood needed across the country comes through donors at the Red Cross. We conduct almost 500 blood drives a day, trying to get 15,000 donors a day. And then we try to keep a 3 to 5 day inventory. So if you do some math with me again, that's about 75,000 donations that need to be on the shelf all the time. And we're seeing that we're struggling to get those 15,000 donors in the door every day consistently, 24/7, 365. There's a constant need. Again, every 2 seconds in America, somebody gets a blood transfusion, and it must be there because it only comes from one person to another. It is not manufactured anywhere. It's simply one human being taking a moment to think about and donating blood to help someone else. Someone they'll likely never know needed it, but will truly have an impact on their life.
So how many hospitals are waiting to receive these blood donations in the state?
There's every hospital could be a potential recipient from the Red Cross. There are those that we are direct suppliers to, and then those we are supplemental. And there's well over 100 hospitals in the state of North Carolina. And so what happens is they might have a subsequent supplier, someone else, because we're not the only blood collector. But when they when that organization doesn't have it, it's sort of like if you were trying to get something for your own household and you really needed it, you'd call another vendor, right? You would call another provider, or go to another grocery store or something. Or back when we were all chasing gasoline, we were, you drive to the next gasoline station, because it's so critical that hospitals have it. So we're all constantly trying to work to get the hospitals what they need, because it really comes down to patient care. Keeping in mind that no blood collector, the Red Cross or anyone else, needs blood, Kimberly. Hospital patients do, and a physician is literally prescribing. It's a prescription, just like if you got a prescription for Advil when you were in the hospital. This is a prescription written by your physician that says, I need 4 units of red blood cells, type O positive, 2 units of platelets, whatever it is that they think is necessary to help you recover or sustain life. And that prescription only can be filled, not from a pharmaceutical company, not from chemicals that are coming out of a compound, but from one human being to another.
So can we talk about now what is contributing to the shortage of blood products? What's going on in the world?
Well, the pandemic continues, though we think, and we've gotten so used to it that sometimes with some of our mindset that it's over, we all know it's still really going on. And so there are a couple of things that have happened. During the initial aspects of the pandemic, blood demand by hospitals actually decreased. But then as hospitals got more and more consistent, we've seen a decline in the number of cases being hospitalized, thanks to the vaccines and other behaviors by people. Blood demand has actually returned to a higher level than it was prior to the pandemic. Well, what's that contributing factor? People put off surgeries, delayed elective surgeries, or other procedures that needed to be taken care of. Now those are open and available, and hospitals are more open to taking those patients and performing those procedures. Secondly, as you've probably read reports, with the lessened pandemic restrictions, we see more people traveling. Increased travel also leads to increased transportation accidents. And so what we also know is that trauma cases have gone back up. So we actually see hospitals asking for more blood than they normally do. It's something you can forecast. You have enough experience in providing blood and blood products that you can forecast it. And we see it actually going up over the last couple of months. Then you combine it with the fact that we still can't go to all of our high schools and universities. We never really get to go to them much in the summertime. We see a decrease in blood donations. So we see demand going up and blood donations coming down, and that gap is creating this shortage. And the only resolution is somebody taking an hour of their time, showing up a blood drive, and letting us take a blood donation.
So talk about for me now how COVID is affecting giving. Are people saying, well, I may get COVID if I go and give blood?
Right.
I don't know how I'm going to be affected by COVID if I show up at a blood drive event. So tell me about that.
Exactly. Initially, we know that was a big concern. People felt, is it safe? What are the precautions you're taking? So we're still doing those universal precautions as we've always done, but we're still asking unvaccinated individuals to wear masks. Some of our staff are still choosing to wear a mask, whether vaccinated or not. If they're unvaccinated, they, of course, wear it. We still provide hand sanitizers, wipe down all the surface areas once a donor gets up off of an area or touches an area. So enhanced cleaning procedures. And so it's a very safe environment to come into. And so we're inviting folks to do so. But the challenge has been finding those locations where schools and universities and even businesses have not been able to host them, Kimberly. So we're having to ask folks to get in their car and drive to us, which is also creating an impact, especially in the minority communities who have less transportation services, especially in urban areas.
So if I've gotten a COVID-19 shot, am I able to make a blood donation? Is there too much going on with the COVID shot?
Yeah. It's a great question. We've had that question because folks have been thinking about getting the vaccine or gotten the vaccine. So here's the general rule. We're going to ask you when you come in, do you know which vaccine you got? If you know that name, you're going to be able to donate blood if it's with it after 2 weeks and you're not suffering from any symptoms. Most people reported sore arms and other things from the vaccine. So we want you to feel 100%. We want every donor to feel 100% when they come in. So the reminder is, yes, you're eligible to donate, even if you've gotten the vaccine. Immediately upon presenting, as long as you don't have any other symptoms, you're feeling well for that day, there's no deferral. If you don't know and can't remember, I got AstraZeneca, Pfizer, Moderna, then we're going to ask you come back in 2 weeks, and we'll take you then after your inoculation or vaccination. So it's important for folks to understand that there is no reason from COVID vaccination. However, we're going to still take people's temperatures. We're going to ask them to feel, well. You shouldn't be donating blood if you don't feel 100% for the day. So if you do that, if you do that, then come in and make a blood donation. But the vaccine is not a limitation.
And that's with any situation, right? If you don't,
yes,
whether you have
absolutely.
COVID or not, whether COVID,
if you're not feeling well, stay home, right? Because we're going to take a pint of blood. That's going to impact how you feel afterwards. So we don't want you to feel worse. It's not good advertisement for you to walk out and say, I didn't feel well after I donated blood. Oh, well, I'm not going to go give either. So it's a very important thing that we take care of our donor so we can also then take care of our patients.
So I want to talk about like safety precautions too, because COVID is still out there. And if I decide I want to go, so what are the safety precautions that you are taking at these sites to make sure that I'm safe from COVID?
Yeah, absolutely. First of all, if you're unvaccinated, we would still ask you to wear a mask. We're going to ask you to use hand sanitizer when you first come in and rub up your hands and things very well with that. Then we're going to put you through the process. And if you come in and touch a computer because you're answering questions, immediately after you're done, the computer actually has a cover over it. Then it's sprayed down and wiped down between you and the next donor. Every phase that you go to, the moment you touch a surface, then the staff member will clean it before the next donor gets there. And so we are taking those precautions and then continuing to social distance people at the canteen areas, things of that nature, so that folks feel safe. And we've had, let me stress, during the pandemic, we have had tremendous donor turnout overall. It was sort of like, I want to go do something, right? The American public is resilient. They said, I want to do something. I want to be positively impacting my community. Now we're just sensing that demand is up, and maybe it's not the thing that's on the top of folks' minds. So Kimberly, these kind of programs are the opportunity to tell folks every 2 seconds, somebody needs a blood transfusion. And in that effort, the only way it can be solved is one person to another.
Yeah, I want you to tell me, Barry, why is type O blood so sought after?
Great. Well, there are 4 major blood groups. Type O, as you just mentioned, type A, AB, and B. When you look at blood type crossing and cross match, when a patient is rushed into the hospital, the likelihood is that they have type O. About 48% of all blood donations or of the population as a whole is either O positive or O negative. So when you get to the hospital, half the hospital patients, nearly half, already have that blood type. So you need to match that. Now, the fortunate thing with O is that it also, in a sense, means 0 blood type. So it can be given to type A, type B, and type AB. So now we can cover 100% of the population if we need to in the hospital with that blood. Now, the doctor and others are going to try to match it to A and B to B and AB to AB, but in a true emergency situation, then O negative, which even is really called the universal donor, can go to everyone. So that type O is just the fact that so many people have it. And about almost half the US population has that type. So if we went to the hospital, then about half the population in the hospital has that blood type, and they just need to match it as closely as possible. So if you're type O, great. If you're type O negative, we've got you on speed dial. We'll get you in there. And then right now, every blood product or every blood type is in shortfall. So don't take anything from this to say, oh, I'm type A, I don't need to go give. No, we need you to come give as well.
Can I have a universal number as to how people can call for information about where they
Sure.
donate if they're interested?
Yeah, absolutely. There's two ways to do that in today's world. Go to redcrossblood.org, redcross.org, or redcrossblood.org. Type in your social security, or not social security number, zip code. I'll get that right. Your zip code. Don't need your social security at that point. Zip code, and it'll populate on there blood drives close to you that you could sign up for. Don't have a computer access or want to have somebody walk you through it? Call 1-800-RED-CROSS. Just simply 1-800, spell out Red Cross on the phone, and you'll connect with someone who can tell you where to get a blood donor appointment near you. And please make that appointment. And then if at all possible, keep it, because we're going to hold that spot for you. And then if you don't come, we're going to miss the next opportunity to fill in that donor. And we really, really appreciate people making appointments.
Barry Porter is the Triangle Area Chapter Director for the American Red Cross. Thank you very much for being my guest today.
Oh, Kimberly, it's always a pleasure. And thank you for helping us to get this critical message out to help save lives.
You're very welcome. And thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening on WNCU 90.7 FM. Be sure to like us, to follow us, and to subscribe to our pages to see some of our archived shows. I'm Kimberly Pierce Cartwright, your host for COVID Conversations. Thank you so much for being with us today.